registered physiotherapist. Today I'd like to tell you about a very common back issue referred to as scoliosis. So essentially what scoliosis is, it's a lateral curvature in the spine. And I also want to discuss one of my favorite stretches and exercises for this particular condition. Scoliosis, there's really two types of scoliosis. One is structural scoliosis, which is essentially when the actual back develops this, versus a functional scoliosis in which there's some other issue which is causing the back to go into a scoliosis. And this type of functional scoliosis can actually be corrected. So for example, if somebody has, let's say, a leg length discrepancy of some type, right? So if one leg is longer than the other, well, what's going to happen is that as a result of this leg length difference, one hip, right, will be higher than the other, and the back essentially will compensate for this difference in terms of hip height by going into this sort of lateral curvature. And then again, as a result of that, there's going to be a tightness in perhaps the lower lumbar spine on one side, and then a correction in the thoracic spine, the mid-back, and then another correction in the neck region. And so again, a lot of times what you'll find with these people is one hip will be higher than the other, one shoulder will be higher than the other. So again, we've got structural scoliosis, which essentially develops where there's no other sort of compounding factor, or there's nothing else that's contributing, so to speak, to a lateral curvature, and then structural and functional scoliosis. A lot of times the scoliosis will develop in adolescence, so typically you'll find this development during a growth spurt of some type. And a lot of times in terms of treatment for this, what we want to do is actually monitor it. So a lot of times doctors, what they'll do is if they notice a mild scoliosis in somebody, let's say they're 13 or so, they'll do multiple x-rays to see if there's any specific progressions with the scoliosis during the adolescent years. And then typically once the bones have fully matured, there won't be as much of a progression or much of a fear of progression in terms of the structural scoliosis. If the curvature degree is larger, some doctors will recommend some sort of a brace, or in really extreme cases, surgery of some type. But for the majority of scoliosis, conservative treatment, physiotherapy is recommended. One of my favorite exercises for somebody who has scoliosis is essentially you place the patient with one arm up in the air and the other one down to the side. And what I'll mention to the patient is to pretend that essentially there's a rope that's tied to the wrist of both wrists, and that what you're going to pretend is that that rope is tightening on either side, right? So essentially what you're trying to do in this case is go against the curvature and to stretch out and breathe deep into the ribs on that concave side, so that side that's tighter in that lower region. And so I'll have patients do this, hold for a good 30 seconds, like I said, and breathe deeply into that tight side, so to speak. Please, again, make sure that these exercises, any of the exercises I give are appropriate for you by checking with either a physical therapist or your doctor. And thanks again for watching, and take care.